Hi, you guys. Welcome back for our daily practice questions. It's day 25, and as always, y'all know I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 26-year-old patient presents with symptoms of asthma that occur less than twice a month with no significant limitations on daily activities. They have no nighttime awakenings. Based on the GINA stepwise approach, what is the appropriate treatment for this patient? Is it A, an ad and y'all, why am I struggling? A, an as needed low dose ICS plus ASABA? Is it B, a daily low dose ICS? Is it C, an as needed low dose ICS plus a LABA? Or is it D, a daily medium dose ICS plus a LABA? Tell me what you think in the comments, y'all. Tell me what you think. All right, y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, based on the GINA stepwise approach, what is the most appropriate treatment for this patient? All right, so I always tell y'all, if the stem of the question is asking you for a treatment, you need to run it back and see if they provided you with a diagnosis. Now, in this event, we know that a diagnosis must be provided because we're talking about the GINA stepwise approach. So clearly there's some form of asthma, right? But a couple of things. We want to look and see if they provided a diagnosis so that we can go ahead and come up with a treatment. If they have not, you got to run it back a step further and look at those assessment findings, right? So that you can come up with a diagnosis because we got to know what it is to be able to treat it. Here, again, this is someone who has come in and they have symptoms of asthma. And so, nurse practitioner has determined that we're going down the path of treating them for asthma. So, based on these findings, newly diagnosed asthma patient, they have no significant limitations on daily activities, are symptomatic about twice a month, and no nighttime awakenings. What is the treatment that we start with? It is C, right? We start with, based off of the GINA guidelines for their stepwise approach, is your as needed low dose ICS plus a LABA, right? So ICS plus a LABA, that combo inhaler, as needed. So C is your best answer. All right, question number two. A 35-year-old patient with asthma experiences symptoms more than twice a week, but not every day. They have nighttime awakenings more than twice a month, and their symptoms slightly interfere with their daily activities. They currently use an as-needed low-dose ICS and LABA combo inhaler. According to the GINA stepwise approach, which treatment regimen is most appropriate for this patient? Is it A, an as-needed low-dose ICS plus ASABA? Is it B, a daily low-dose ICS? Is it C, a daily low-dose ICS plus a LABA? Or is it D, a daily medium-dose ICS plus a LABA? Tell me what you got in the comments, y'all. And I saw that one of you have started putting present in here or a check mark. I love it, y'all, because sometimes I feel like I'm talking to myself, so I don't know if y'all are receiving it, if this is helpful, until I get on calls and they're like, yeah, I listen to you every morning on the way to work or whatever. Yeah, check in, even if it's just a check mark to let me know that you're here, so that I can have the encouragement for y'all, as well as checking in with y'all to see how y'all doing. So put your answer in the comments or check in the comment or question mark if you struggle with it. Let's be interactive here. But all right, let's read the stem of the question. According to the GINA stepwise approach, which treatment regimen is most appropriate for this patient? All right, so what's going on? Again, we're talking treatment. Again, they have already included GINA, so we know we are talking about a treatment for asthma, right? But we now have to determine what's going on so that we can figure out what's most appropriate in the treatment process that we're in. So we have this 35-year-old patient, and it tells you that they have asthma, right? So this is not like question number one where they say they came in with symptoms of asthma. This person is already a patient with a history of asthma. They're experiencing symptoms, and always pay attention to the words because those little simple words like a patient with asthma can help you tremendously with answering things. So, an old patient, a 35-year-old patient with asthma, experiences symptoms more than twice a week, but not every day. They have nighttime awakenings more than twice a month, and their symptoms slightly interfere with daily activities. All right, so they have a lot going on. It's not, you know, completely to the most severe state. But currently, whatever they're being maintained on is not managing them in their symptoms, right? They currently use an as needed low dose ICS and LABA combo inhaler. All right, so let's think about that GINA approach, right? So in step 1 and 2, we start you out with that low dose ICS and LABA combo inhaler as needed. But when it shows just like this that you already on this, but you are still having this many breakthrough symptoms, we need to put you on a maintenance regimen, meaning you need to be on it every day. So now you want to put them on that low dose ICS and LABA combo inhaler daily, okay? And so that would be your answer choice C, a daily low dose ICS plus a LABA, okay? That's your combo inhaler. All right, now question number 3. A 50-year-old patient with asthma presents with daily symptoms and frequent nighttime awakenings occurring more than once a week. Despite using a low dose combination inhaled corticosteroid and LABA inhaler daily, the patient has frequent exacerbations and reduced quality of life. According to the GINA stepwise approach, what is the most appropriate next step in management? Is it A, we're going to increase the ICS dose to medium dose, B, add a leukotriene receptor, C, increase the ICS dose to high dose plus Adalaba, or D, no changes are needed at this time? Take a moment and tell me what you got in the comments, y'all. All right, so here, stem of the question states, according to the GINA stepwise approach, what is the most appropriate next step in management? All right, so the most appropriate next step, we're talking about a patient here, 50 years old, has asthma, and they're having daily symptoms, frequent nighttime awakenings occurring more than once a week, despite being on this low dose combo inhaler of the ICS and LABA daily, right? The patient has frequent exacerbations. So they're already in that tier of the low dose combo inhaler daily. So now what we need to do is A, increase that ICS and LABA combo inhaler to a medium dose. So, you know, the inhaler is a combo, right? A combination of an inhaled corticosteroid plus a LABA, typically like budesonide plus formoterol, right? So know your medicines too, like I was telling you on yesterday. Don't just simply know the drug classes, know the drug names that fall into those classes. But it's typically like a combination of budesonide being your inhaled corticosteroid plus your LABA, your long-acting beta agonist being formoterol. That's classic. Um, but we just up the dose. So if you're on a low dose every day and you're still having all these breakthrough symptoms, GINA guidelines say we step up, right? And we just bump up the dose to medium dose. So A is your best answer. And I hope that wasn't confusing because I just simply put increase the ICS dose to medium dose, but it should be the ICS combo inhaler. So, but it's A. We're increasing to the medium dose, but yes, I should have put plus LABA on there so it's not confusing to you guys. But we want to increase this. They're currently on the LABA plus ICS combo inhaler at a low dose. They're still having breakthrough, so we step up and increase that low to a medium dose. Okay, so no changes in medicine, just changes in dosage. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. As you know, we're going through our respiratory series right now. And with these guidelines, y'all, I know there are more. GINA has changed and it updates annually. But what I prepare you for and the steps that I tell you are for what are currently being tested on the exam. Again, I go through and I'm going based off of the year that they're following. So I'll teach you from that perspective. Also, for GINA guidelines, remember I always say that what they're doing is, over the years, we have determined when we just start adding inhaler, the average patient is not compliant with all of these. So that is where the response and the adherence wasn't as great. And so it was found that these combo inhalers work better. So that's why this is the preferred controller. It's not that you can't use the alternative, but they are pushing towards the preferred. And this is the year that the year of the GINA guidelines that they're currently on the test. Because remember, the tests do not update but every 3 to 5 years. So it's not going to be where we are currently in practice. So that's why I always say that I'm teaching you from the perspective of board preparation currently. And then I also can teach you on things in practice. But when I tell you stuff like on these questions, it's for what you're testing on currently. Okay. So again, GINA is the preferred controller, are those combination inhalers. And the approach is simply to start with a low dose as needed of the combo, ICS and LABA. Then, if you're still having that breakthrough, when you get to step 3, we're bumping it up to a daily maintenance regimen. So, still that low dose, but you need it more than just PRN. We're going to give it to you every day, right? To try to prevent those breakthroughs or any gaps, right? More like a prophylactic style management. Okay, if you say you're still having, if your patient is still having symptoms either even on the low dose every day, then now we need to increase the dose. Think of it just like you would do blood pressure. Hey, if I have you on 5 milligrams and your blood pressure is still not at goal, I'm going to put you on 10, right? So same thing. We're not changing the medicine, we're upping the dose. So you went from a low dose of the combo. Okay, you're not controlled. I upped you to a medium dose. You're on the medium dose and you're not controlled. Okay, then I up the dose to a high dose. Okay, so that's all it's saying. And that's why I'm big on looking at it in a chart. If y'all look at my books or my classes, y'all know I always put things in a chart so you can see it and it narrows it down so you're not getting so flustered of all the moving pieces and parts. Because when you see it like that, it's like, oh, this really isn't as chaotic as it seems. But that's a whole nother rant for a whole nother day. Again, I hope you're finding this helpful. Y'all be sure to meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1 at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions, any of my coaching packages or plans, I always say either call, text, or email because I prefer to speak with you first to make sure that you are booking the appropriate session types. All right, you guys. As always, y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.